Good morning again, everyone. So my name is Laila Shim, and I am the research analyst at the National Drug Council, and I'm so happy to be here today to introduce and provide an overview of what the Cayman Islands Student Drug Use Survey is before Dr. Erica Lam then presents the mental health data from the 2024 survey. So, the Cayman Islands Student Drug Use Survey, or what we refer to as the SISDUS for short, has been conducted by the National Drug Council every 2 years since 1998. And this survey is conducted among all students that are enrolled in years 7 through 13 or grades 6 through 12 in both our public and our private schools in Grand Cayman as well as Cayman Brac. And the purpose of the survey is to track and monitor the trends in youth substance use over time. But the survey has also evolved over the years to monitor other indicators of health and wellness as well, such as mental health, which was included or added to the survey in 2018 in partnership with the Alex Panton Foundation. And it is important to note that this mental health section of the survey is only given to our students that are enrolled in years 9 through 13, or the grade equivalent of grades 8 to 12. In the 2024 survey, we had a total of just over 18 schools, as well as the homeschool population that participated in the biennial survey. In total, we received just over 3,300 student responses, which informed the data analysis, and this equated to a participation rate of 77.5% of our secondary school student population. The 2024 survey also marks the first fully completed cycle of our new modular format, which was introduced back in 2022 when we transitioned the survey online. So this modular approach has significantly reduced the length of the survey by dividing questions into 2 module sets. Set A, which was completed back in 2022, and Set B, which was completed in 2024. And so while our core demographic questions, our consumption pattern questions, and the mental health questions will remain the same regardless of the module cycle that we are in, other topics will rotate based on the particular module set that we are in. So for example, in 2022, Set A would have included additional questions on peer and individual relationships, as well as antisocial behaviors. And in 2024, we had questions on parental involvement, family substance use, and students' access and availability to substances. Moving forward, we will continue with this alternating cycle. So Set A will be scheduled to return in 2026, and Set B module questions will return in 2028. And so with that being said, I'm now happy to invite, I went too fast, Dr. Erica Lam to provide an in-depth overview of the mental health data from the 2024 survey.
So I think we go. Okay. Yes, there we go. So the graphs here show if the student were taught about mental health in school. There is a positive increase since 2018, showing that mental health is actually getting into mainstream school, which is really positive. And the graphs here, as a trend, more students describe the mental health as good and fair in 2024 than 4 years ago. The good news is that less students believe that their mental health or emotional health were poor in 2024. When the students were asked if they had seen a doctor, nurse, or counselor about their mental health in the past 12 months, over 40% of the students said that they had. Girls are more likely to see a doctor in comparison to boys. I don't think that's a surprise, hearing what our speaker was saying this morning. There is a slight increase since 2020 as well, which is quite good news. But let's not overlook the fact that there are still over 50% of the young people out there have not sought help about their emotional health. It's kind of like saying that about half of our young people have not seen a GP or a dental hygienist. According to World Health Organization, 10% of the children and adolescents experience a mental health disorder. The data in the United States and the UK said that about 20% of the young people have a mental health disorder. This is a graph in the Cayman Islands. We have 16.5% of the young people said that they have received a diagnosis of mental health disorder. That is 337 students in the Cayman Islands. There's double amounts of the young girls than boys. As a trend, we see that there is an increase of mental health diagnosis as well. A large portion of the students who report being diagnosed with a mental health disorder also said that they have sought help about their condition, and it's not a surprise. Girls are more likely to speak out than boys. Interestingly, there is a slight reduction of help-seeking behavior since 2020, according to our data. For most part, students sought help from counseling services, families, doctors, or religious institutes. The main reason given for not seeking help indicate that they are feeling they don't need it or not know if it will help, fear of judgment, or being embarrassed to access support. This means that family doctors, church members, and nutritionists need more support in identifying mental health and directing our young people to the right services for treatment. This is a very encouraging graph, one of my most favorite ones this year, analyzing this data. This is to show that the barriers in help seeking are reducing since 2020. The most obvious one being that I'm embarrassed to access help or support has gone from nearly 10% down to 2%. I felt disappointed with services has gone from 3.5% to 0.5%. It is also really, really nice to see long waiting lists as a barrier has gone from 1.3% to 0.2%. It seems like in the space of last 4 years, us as a community has listened to our young people and improved accessibility of mental health and reduced stigma. Absolutely, isn't it, when you're able to see the trend? This year, we used the Short RCARDS 25, which is a short self-report questionnaire for children and adolescents aged 8 to 18, to measure a broad range of anxiety and mood disorder using 15 items according to the DSM-5. We got a really good number of sample here. About 934 students have completed fully on this section, so it's a good sample size. So this graph here shows the percentage of students who score in the clinical range by gender. Clinical range means that their experience of symptoms is severe enough that warrant a diagnosis and a treatment plan. In 2024, surprisingly, no student meet the diagnosis of social anxiety. I think this is maybe quite good news because social anxiety, social withdrawal can exacerbate isolation and loneliness. Maybe something to do with the post-pandemic, that where students feel that they need more social connection. Maybe they experience social anxiety symptoms, but not at the point of isolation. So also we have quite high number of generalized anxiety disorder, which is about worrying, ruminating on their worries, followed by panic disorder, separation anxiety, and depression, OCD, and social phobia. 4.5% of the diagnosis of depression is still quite worrying because depression can lead to suicide, and that we know anxiety and depression disorder can profoundly affect school attendance and schoolwork. Globally speaking, depression, anxiety, and behavioral disorder are the leading causes of illnesses and disability in adolescents. Specifically, it is estimated about 3 to 4% of the young people experience anxiety disorder. This is a graph in the Cayman Islands. We have over 4.5% to 6.5% of the young people meeting clinical threshold of anxiety. What does that mean? It means that we have higher number of diagnoses and disorder and symptoms than global data. Another heartbreaking fact is that depression is estimated to occur about 1% in the adolescent population in the age group of 10 to 14, and nearly about 3% in the age group of 15 to 19 years old. In the Cayman Islands, there is 4.6% of our students indicate that their symptoms will meet the clinical threshold of depression in the age group of 13 to 18. Again, 4 times higher than global data. The consequences of not addressing mental health and psychological issue or social developmental issue in adolescence means that it will lead on into adulthood and limit opportunities of living a fulfilling life, therefore having direct impact in our economy. So let's look at the predictor of mental health. So these are the significant risk factors that contribute to the diagnosis of anxiety and depression. And we have done a regression analysis, meaning that these are statistically significant numbers. The current use of cigarettes, alcohol, self-harming, suicidal ideation, attempted suicides, and those who identify themselves as non-binary or others in gender are the risk factors. And I think hearing the qualitative data from Dr. Basson from the event really explain why. The protective factor is quite interesting here, is the past use of marijuana, the grade level, and those who sought mental health support. Right, I'm not here to sell drugs, okay? But I think it's quite interesting that young people who use marijuana in the last year is a significant protective factor. What does that mean? Me as a clinician is making some hypothesis here, and this is something that I'm actually quite interested in looking into. And talking to Laila, going into the data, we know that young people usually use marijuana in parties. What does that mean? They're getting more social connections. And I wonder whether the combination of self-medication and social connection actually serve as a protective factor for mental health, which go back to what Dr. Basson was saying about connection, feeling safe, and managing symptoms. We're going to be looking at some self-harming data. Please take care of yourself. Overall, there is approximately a quarter of the students said that they have engaged in self-harming behavior. That is 544 students. Again, more girls than boys. And there's a significantly number as well, nearly kind of double of young girls reporting that they engage in self-harming. This is a very encouraging graph, I think. Self-harming behavior is slightly reducing since 2018. This graph shows the type of self-harming behavior engaged by boys and girls and those who identify as others. There's high percentage engaging in pinching, scratching, followed by cutting, then hitting or banging body parts. We're going to be talking about suicidal ideation. According to the World Health Organization, suicide is the third leading cause of death in the age group of 15 to 29 years old. 73% of the global suicide occur in low and middle income countries. The reasons for suicide are quite multifaceted and influenced by social, cultural, biological, psychological, and environmental factors present across the life course. So it's important to bear this in mind that every suicide, there are many people who have attempted. So prior data on suicide attempts is very important as a risk factor for preventions in the general population, and that is why we're collecting this data. When we ask students whether they have ever seriously contemplated attempted suicide, about 1/4 of the students in grade 8 to 12 said yes, that they had seriously considered attempted suicide. That is 529 young people in our country. There's a significantly higher portion in girls than those and those who identify as other in comparison to boy. We also ask our students whether they have attempted suicide. The prevalence of actual attempted suicides was 12%, which is 247 students who have tried and want to end their life. They were simply not successful. Of our students who attempted suicide, about a third of them said that their suicide attempt results in an injury, and about over a third of them has sought help about their attempt. As a clinician, this is actually really worrying for me because it means that about 170 students out there have tried to end their life and have not been treated. Another worrying fact is that looking at the trend, there seems to be an increased number of students considering suicide and attempting suicide since 2020. The good news is that there is a significant increase in help-seeking behavior in 2024. As you can see, it's a significant increase, and I think we can contribute this to all the interventions such as Alex's Place, Kids Helpline, and our private sector making mental health more accessible in response to the crisis. Students were asked to indicate who they would speak to when they had thoughts of suicide. Most of the time, students report speaking to another person, friends, boyfriends or girlfriends or family. There is a notable number of people said that they won't speak to anyone. So what this means is that psychoeducation in the general public is really important. The other person that the young person speaks to might be the one who can save their lives. So mental health first aid, suicide prevention training, or harm reduction awareness training need to be accessible to in the general public, just like first aid training for physical injury. Remember, suicide is the third leading cause of death in young people. We can be saving their lives. The risk factor for suicide are multifaceted and include harmful use of alcohol, abuse in childhood, stigma against help-seeking, barrier in accessibility, and the access to means to suicide as well. Obviously, digital media, as Dr. Basson has already said, like any other media, play a very significant role in enhancing or weakening social prevention effort. Here are the local data collected from our students showing us a significant risk factor that contribute to suicide ideation and attempt. There's 4 variables that are statistically significant in predicting attempted suicide, which is past years' use of cigarettes, self-harming, being diagnosed with mental health issue, or identify themselves as other in gender. So what does that mean? Is that please do not ignore self-harming behavior. Those who engage in self-harming behavior is 11 times more at risk in attempting to take their lives. This also indicates that the need of inclusion and acceptance of diversity and gender. There's 2 significant protective factors that are helping to reduce the risk of suicide is being in grade 11 and 12. So there is something quite unique about these 2 grades in school. I wonder what they're doing that is helping them to protect the mental health. And I think it's worth further exploration as well. So just to wrap this up, the World Health Organization has recommended a series of evidence-based intervention, limit access to means of suicide, supporting media to report suicide responsibly, social emotional literacy program. I hope you have the opportunity to see all this great work that Alex Panton Foundation has been doing in terms of CIPI, Apple, Sunshine Circle, all of those things that in collaboration with our education partner in preventing and protecting our young people's mental health. And interventions for those who are affected by suicide, as Dr. Basson has outlined, that is a huge piece of work in HSA and Alex's Place as well. So as you can see, we're actually doing quite a lot of this in our community. And then my last slide here is just to illustrate all of the things that we were saying this morning. World Health Organization emphasized that suicide prevention efforts must be comprehensive and integrated in multiple level and with multiple sector in our population, involving all the sector in the society, such as raising awareness, building capacity, monitoring and evaluating. And just looking today in this room and the package of sponsor really bring warm to my heart to know that we are doing all of this as a society. Thank you. Please take care of yourself for those who might feel saddened by the data. Please get some support. Thank you.